Madam Chair, Board, we are live and ready to go when you are.
Well, good morning, everyone. Welcome to the Tuesday, September 7th, Washington County Board of Commissioners work session. This is Chair Catherine Harrington, and the other commissioners with us today are Commissioners Pam Treese, Commissioners Jerry Willey, and Commissioner Roy Rogers. Commissioner Nafisa Fai is excused. Oh, there she is. Good morning, Commissioner Fai. We're just getting started. It's wonderful to see you this morning. Wonderful to see all of you. Welcome to the month of September here after Labor Day. We're going to have a fun proclamation on our Board of Commissioners meeting at 10 o'clock. But before then, we've got some work to do here in the work session. So we're going to start move our usual board and leadership communications to a little later on the agenda this morning. And we're going to dive right into our first topic, considering the adoption of Policy 317, COVID-19 vaccination mandate for healthcare workers, and our robust discussion. So at this juncture, I'd like to turn it over to our senior executive staff, Ms. Tanya Angie and Tom Carr.
Good morning, Chair. I'm sorry.
Oh, no, Tom, I was going to turn it over to you. So.
Good morning, Chair and board members. We'll be presenting this morning. Joining me this morning will be Ms. Marnie Kyle and Ms. Eva Labonte. I will be presenting on the legal issues. Ms. Kyle will be presenting on the medical issues, and Ms. Labonte will be presenting on the employment issues. We have a PowerPoint presentation which we will be going through. To start out, I want to sort of set the context. As you saw, the item that this is, the agenda item is entitled reference to policy number 317. That is a administrative procedure allowing the county to implement the state mandate for vaccination of all healthcare workers. That is on your action item agenda for the board meeting today. The presentation here is to provide you background about that order, but also at the last regular working session for the county commissioners, there was a discussion about extending that vaccine mandate to potentially all or a greater group of employees. So we provided some background there to enable a commissioner's discussion on that topic if you choose to go there. If the commission decides or directs us at the end of this session that you want to extend it beyond the draft of procedure 317, we will have a draft for you to consider this afternoon for a more extensive mandate. So if you choose to direct us that way, you'll be able to have that discussion at your regular business meeting and potentially adopt a broader vaccine mandate for a greater number of employees. So with setting that context, I'd like to turn it over to Ms. Kyle. And could we go to the next slide, please?
Good morning. Thank you, Tom, Chair Harrington and Board. Marnie Kyle, Director of Health and Human Services. And I'm just here really to provide you with the updated information where we are in the pandemic as sort of context and background for your discussion. So Washington County, the current case rate continues to climb. It's 184.5. I think there was a time last spring where we were above 200, but these numbers are starting to look pretty scary again. We haven't been this high since January of this year. And according to the CDC community level of spread, we are in the high transmission level of spread because of the high case rate. Our total positivity test case rate is 1.8, which is also increasing from previous weeks. We can go to the next slide. So hospital capacity has been a large concern throughout the pandemic. And this graph shows that the hospital capacity, as you know, you've seen over the last few weeks, continues to rise. There are some reports on the news today. I haven't seen anything from CDC or OHA that potentially we've reached some sort of peak. But I will say, I think the case is out. Let's see what the Labor Day weekend and large gatherings have brought us, and school starting this week. So I think we're going to continue to keep a really close eye on this. Hospitalizations in Washington County continue to be high. This was data as of Friday. We had 130 people that were admitted as of September 2nd, and 30 of those patients were in the ICU. We do have National Guard personnel that are placed in our hospitals to assist with this surge because workforce, as you know, is one of the really concerning issues. And because we've talked about this before too, but because we're a medical hub for the region, our state, our hospital numbers are impacted by transfers from patients in other parts of Oregon. So next slide, please. So just want to set the stage for public health recommendations as you have your conversation today. I think it's important to remember that vaccinations are safe, they're effective, and they are our most effective tool to save lives and reduce hospitalizations. Mask worn indoors and outdoor settings is the second really important public health measure to prevent the spread of COVID-19. Also maintaining physical distancing and limiting our social gatherings. So just wanted to remind you of the public health strategies that are so important as we have all of these conversations. And I believe I am turning it over now back to Eva Labonte to talk about the policy. Commissioner Treese?
Yes, I have a question, Ms. Kyle. Could you go back to slide 1, the discussion on case rate?
Yes. Ooh, yes.
Thank you. You said that our current case rate is 184.5 and the high transmission level is above 100. I just want to point out that that seems like it's considerably higher than just high transmission rate. Is that an accurate interpretation?
It is definitely very concerning numbers. The CDC just has these 4 levels of community transmission, sorry. And red is the highest. So anything over 100 per 100,000 is a high transmission risk rate. And I just mentioned that there was an old OHA transmission rating that had a higher level. And so, yeah, these numbers are, you're right to point out, these are very, very concerning numbers.
Yeah, I just wanted to highlight that because it's nearly double what the base level is. So,
yeah, thank you.
Okay, thank you.
All right, I think it's my turn to jump in. Good morning, Chair Harrington and Commissioners. My name is Eva Labonte. I'm the Chief Human Resources Officer for the county. And this information is typically what Ms. Angie would be presenting to you in your work session. I just wanted to take the opportunity to share with you where we are with our current employees right now. So currently we have 9 employees that we are aware of who are in isolation and off work because they are COVID positive. We also have 14 people who have been identified and verified as close contacts. And those people are also off work in quarantine. And if you are off work in quarantine, that means you're unvaccinated. We also have 10 people who were qualifying as close contacts, but because they're fully vaccinated, they can continue to work as long as they're asymptomatic. And that's following Oregon Health Authority guidelines.
I want to pause here for a couple of questions on that. Because it's just the state of affairs and not getting into the policy. Right now, could you remind me of the policies that we have in place right now so that if someone is unvaccinated and has to stay home because they're either in isolation or they need to quarantine, are they eligible for special leave or are they using sick time?
Yeah, we did bring back our temporary policy 315, which allows both vaccinated and unvaccinated people who are either COVID positive or need to quarantine. We are allowing them to use COVID absence leave and not their own accruals. Part of that policy also has a very robust opportunity to telecommute, even for employees who don't currently have telecommuting opportunities, in order to allow them to continue learning and contributing to the organization. So employees who are not actively ill are highly encouraged to use that telecommuting opportunity. And those that are actively ill do have the opportunity to be off on COVID leave.
Thank you for the reminder. We've had so much change during the course of the year that I just need the reminder along the way. Go ahead, Commissioner Treese.
Thank you. One other clarification, Ms. Levante. Can you remind me how these numbers compare to the numbers that we've seen for our employee base over the course of the pandemic? I don't remember what our numbers were previously.
And, you know, it's interesting, like Ms. Kyle was referencing, these numbers are very similar to where we were at in January of 2021, where we had an extremely high rate. The difference is right now that we have the vaccination in place for some of our employees. So those 10 people who are close contacts are able to continue working. We do have some breakthrough cases, but those people are typically asymptomatic or pretty mild symptoms like you're hearing in the news. And often they can continue to telecommute, but they absolutely need to be off work. So it is a little bit different landscape with the vaccine available, but the numbers that are being reported are still about the same as January.
One other clarification, you said we have vaccinations in place for some of our employees. I just want to underscore that it's for all employees, correct?
Correct. Yes, my reference was to those that are currently fully vaccinated.
Yeah, thank you.
Mm-hmm.
Yes, vaccinations are available for everyone over the age of 12, though there are certain people who are not health eligible to be vaccinated. But otherwise, yes, we've had general availability of vaccinations since the very end of April. So for a number of months now. Thank you, Commissioner Treese. Yeah, and thank you, Eva, for helping us make sure we're on the journey.
Happy to help.
So this is me. I wanted to provide some context for the board on what the law is around vaccinations in the state of Oregon, and specifically then drill down into the current mandates. So what I've got on the screen there is Oregon Revised Statute Section 433.416, which was adopted sometime back in the 1980s, I believe, and it may have been adopted to deal with the HIV crisis. But what it says, Section 1 requires that an employer whose employees are exposed to infectious diseases provide vaccines. Section 2 requires that they be provided for free. Section 3 says that you can't force certain employees to be vaccinated. Now, I wanted to point out a couple of things in that section because there's no case law interpreting this, and there's some ambiguity in the language. So if you look at subsection 3, you'll see it uses the phrase worker, and I've copied in the definition of worker from Oregon Revised Statute 433.407, which applies to this section. And it covers healthcare providers, firefighters, law enforcement, and corrections officers. So a worker is defined in very broad terms. And subsection 3 says, a worker shall not be required as a condition of work to be immunized under this section unless such immunization is otherwise required by federal or state law, rule, or regulation. Now, since I'll be speaking in a few minutes about the healthcare worker mandate that the governor has issued, so that clearly is an exemption from this because there's a state rule or order requiring healthcare workers to be vaccinated. There's nothing in that order that necessarily applies to firefighters, law enforcement, or correction officers. So there's an argument that you cannot, no employer can require any of those folks to be vaccinated. I highlighted the words under this section. To me, that interposes some ambiguity because there's a principle of statutory interpretation that you don't read words out of a statute, that if the legislature put them in, you have to give them meaning. And the meaning would be that you can't require under this section doesn't mean you can't require with other authority. So this is not necessarily a complete bar. So as I said, it's open to interpretation. It is state law, and there's no case law interpreting. Next slide, please. So the state mandate for healthcare workers, it requires that all healthcare workers be fully vaccinated by October 18th, 2021. It defines fully vaccinated as 14 days after your final dose. There are exemptions for both medical and religious reasons. So I want to talk about that a little bit. The state has provided forms, which we will be required to use either exactly or on our own documents, but they're substantially the same. We are required to keep those in a confidential personnel file for the employee, but we're also required to provide them to the state if the state asks for them. In a recent FAQ, the state said that they were not necessarily planning to ask for them or to monitor exemptions, but we would be required to turn them over if they ask. The mandate requires the employers to adopt a policy to implement the mandate. So that's policy 317, which you're considering this afternoon. That is required for us to implement it. And as you can see, if you do the math on the deadlines, if you're going to get a 2-dose vaccine, we're pretty much at the very end of our time. We don't have a lot of time to implement this because for an employee to be fully vaccinated by October 18th, if they're getting a 2-dose vaccine, they pretty much need to be vaccinated already, at least have the first dose for some of them. And under Washington County law, the board needs to approve this policy as an administrative policy. We can't just implement it as staff. We will implement procedures to implement the policy itself, but the policy has to come from the board. Next slide, please. So I want to do a little bit of a timeline. The first executive order was issued on August 5th. On August 12th, it was revised to remove the testing option. You may recall the original mandate said that you could keep your job if you got tested regularly. The governor removed that. On August 30, they issued the first FAQ, and on Friday, they issued a second FAQ. So we've been sort of trying to adapt with the explanations the state has given us. So I wanted to talk a little about those. Next slide, please. So this is one of the FAQ questions. So one of the things we talked a lot about was, does it apply to the jail? Is the jail a healthcare facility? And so this is the state's response with respect to healthcare facilities. And the first part says that it doesn't apply to state-owned facilities, but they're covered anyway under the executive order requiring all executive employees to be vaccinated, executive branch employees. It explains that it does apply to correctional facilities, but it pretty much limits it seems to limit it to the healthcare facility within the jail. So it doesn't apply to all officers. And a reasonable interpretation of the language of this rule, if you look back at that exemption I showed you before, it specifically called out corrections officers. So you'd think that if the state had intended to include corrections officers and probation officers, they would have said so. They specifically took the category of healthcare workers, which again is a category in that section 466 statute. So it's a reasonable interpretation that only the healthcare unit at the jail is specifically covered by the governor's mandate. Next slide, please. And this was a FAQ that came out on Friday. Because one of the things that we've been troubling over are sheriff's deputies who are on patrol, who do occasionally deliver medical services, transport people to hospital, provide first aid, give Narcan. Are they healthcare workers? And the response is probably not. While a police officer may have some medical training and may even be a licensed healthcare provider, it is not likely a fundamental part of their job to provide direct or indirect medical care in a healthcare setting. And so that's new language that we hadn't seen. But it seems like their interpretation of the rule is it a fundamental part of your job to provide direct or indirect medical care in a healthcare setting? So they pretty much eliminated most law enforcement with this interpretation. Next slide. So this is the definition of healthcare worker in the order. And I'm going to read it because it's important. Individuals paid and unpaid, working, learning, studying, assisting, observing, or volunteering in a healthcare setting, providing direct patient or resident care who have the potential for direct or indirect exposure to patients, residents, or infectious materials, and includes but is not limited to any individual licensed by a health regulatory board, as that is defined in ORS 676.160, unlicensed caregivers, and any clerical, dietary, environmental services, laundry, security, engineering, and facilities management, administrative, billing, student, and volunteer personnel. Now you can see why we were trying to puzzle out whether or not everybody in the jail was covered, because you could argue that a deputy who's working in the jail is a security personnel in a healthcare facility. But I think they've told us that it's not. So I think we're reasonably safe in our current interpretation. Next slide, please. And so the definition of healthcare section is any place where healthcare, including physical or behavioral healthcare, is delivered. So it's important to note that it includes behavioral healthcare. Next slide, please. So I'm going to turn this over to Ms. Labonte.
Yeah, thank you. So right now we have communicated with, both in writing and having meetings with department director and human resources for these two departments, where clearly the people in these departments fall under the guidelines of healthcare worker. And Health and Human Services, we have 230 employees who fall into that. So certainly anyone who delivers behavioral or physical healthcare, board certified, and those who work in schools. And in juvenile services, we have 83 employees who fall under that. Juvenile counselors often work over in Harkins House, who has been required by the state. We received a letter. The Harkins House staff absolutely falls into it because of their behavioral rehabilitation services funding. And the rest of the juvenile counselors do work in schools quite often to see their youth they're working with, and also come over to Harkins House. So these people all fall under the policy that you're considering this morning, policy 317. So that's 313 employees currently under the policy. Next slide. So the policy that we have presenting in front of you today, so we are asking employees who are impacted by the policy to provide proof through our confidential human resources information system to upload documentation. And that documentation would either be proof of being fully vaccinated or a religious or medical accommodation exemption form. And those forms will be reviewed and accepted. Let the employee know that we have them and they are accepted, or if we need further information. And as Mr. Carr said, those will be kept in their confidential medical file and human resources. So the question about compliance into this policy. So part of this policy is asking your board to extend the definition of medical layoff to include people who are unvaccinated or do not have a medical or religious exemption on file and fall under the policy. And the difference between regular separation from employment and being separated under a medical layoff is that medical layoff allows the employee a 1-year window to either become fully vaccinated or have an accepted exemption on file. And if that's the case, and a position is open in the classification they were in when they left the organization, they can re-enter the organization and continue to be employed. Under our procedure, we recognize fully, as Mr. Carr mentioned, that this time frame is very short. So we are including in the procedure and implementing the policy a temporary exemption for employees who show documentation that they are at least having the first of a 2-shot series for vaccination. They could go ahead and utilize accruals until they got their second shot. Any employee who has both vaccines, or they have the first dose and only dose for the Johnson & Johnson vaccine, would be allowed to continue working as long as they're wearing a medical grade mask. So we're trying to assist our employees who are under this short time frame and need to get fully vaccinated.
Can I just make sure I understand the medical layoff? So if someone is on this medical layoff, their job is not held for them, right? We can go and hire someone else. to do that work so as to make sure the work gets done and the remaining employees are not overextended. But if we have a position available, once they complete, then they can be rehired back.
That's exactly right.
Okay, thank you. I got it. Commissioner Treese, go ahead, and then Commissioner Willie.
I just want to ask the question, there would be no back pay for somebody who's on the medical layoff, and then returns to work. They wouldn't be paid for the interim that they were off, correct?
That's correct. Medical layoff is a form of separation from employment. So they would not be employed at that point in time.
Commissioner Willie, go ahead.
Yeah, well, and continuing with that theme a little bit, so I'm assuming they would not qualify for unemployment?
That's a decision made by the unemployment division at the state. Washington County has no voice in whether or not someone receives unemployment benefits.
And so if they would decide to come back in a year, do they assume the same level of pay and benefits? And so if they'd been here long enough that they got, I don't know, 3 weeks of vacation, do they step back into that same level of employment?
Yes, they do. We do cash out vacation and other accruals that are cashed out when employees leave the organization. They would have their sick leave reinstated as it was when they left. They would not accrue new vacation or new sick leave accruals when they were off on medical leave, but those would be reinstated and the benefits would be reinstated where they were at.
Okay, thank you.
Any other commissioner questions before we move on? Okay, I think we're with you, folks. Next slide.
So as I said earlier, the action that we're requesting today is to adopt the healthcare worker policy 317. You of course have the option of directing us to expand it, and we'll be prepared to bring something forward if that's where the direction comes. So now we're happy to answer any questions or to just enjoy the commissioner's discussion.
Go ahead, Commissioner Willie.
Well, it just seems to me that we really don't have an option on this. I mean, this is a governor mandate. So do we have the option of saying no, thank you?
No. I mean, you always have the option of saying no, Commissioner Willie, but I would not advise it since it's pretty clear.
So really
Well, yeah.
what I think they're trying to get at is there are two things. One is the implementing the state requirement for healthcare workers. But then the second is, do we wish to go with the second bullet and expand vaccination requirements or vaccination policy across the organization?
Okay, thank you for that.
Yeah. Does anyone want to kick off, or do you want me to? Commissioner Rogers, go ahead.
Okay, this is probably one of the more difficult ones for me. You're talking to a guy who is fully vaccinated and fully intends to get my booster as soon as they'll allow me to get it. So I'm a big proponent of vaccinations. I've talked to many folks and argued that point. But the issue for me is personal freedoms versus our policy. I want to first say that I appreciate the briefing the other day from both Marnie and our legal counsel, Tom. They went through this, and I think they've done some really good work and are trying to thread the needle. And so I want to compliment you about that. But it's a very slippery slope when you start comparing personal freedoms against mandates by government. And so I'm inclined to vote no today, and not because I don't believe in vaccinations. I think that they're important. But but I'm concerned about that first issue. My second issue is that while I think you're trying to make accommodations, I don't know if you've made reasonable accommodations in terms of asking people to go to other departments, other openings in the organization that may be qualified for. I don't know that we've heard from bargaining units. I don't know that we've heard from employee groups who may be opposed to all of this. And so, as I say, it's with heavy heart that I'm voting no. I really think we need to give it some time. And I understand it's a governor's mandate. If she wants to mandate it, she can mandate it, and she can require us to. I mean, that's fine. And maybe she feels in her mind that she has. I had the same concerns about restaurants when we said we're going to not allow them to operate, and yet I could go to Costco, Fred Meyer, Safeway, Winco, you name it. I could stand 2 feet from somebody, and so we're hitting a profession that there's great shortages in. Not that excuses it, but I'd much rather have that compliance through conversation, compliance through education, compliance by people understanding that they don't have a right to impact me, my kids or my grandkids. They don't have that right. They need to do something. But do we have a right to say, gee, now it's the police next, and then it's the LUT staff because they have over the counter, and the only ones who are immune are those who have the ability to work from home. So I've got lots of concerns, as you can hear, but it's with heavy heart. That's where I'm at.
Seeing no one else muted, I'll go ahead. So clearly we need to put in place the steps here in Washington County for healthcare workers as defined by the state. We just need to do that. As to the question, and I appreciate, along with that, I appreciate all of the work that our HR team, the department directors, including HHS, Health and Human Services, and Juvenile, but also Community Corrections and Law Enforcement Patrol have done to really examine the requirements from the state, and with the help of the legal team to also consume the information from the state as it has been evolving and changing over the last few weeks. So I will be voting to support the implementation of the state requirements. To the second question, darn, I was just going to refer to it off of the slide. That's okay, no worries. Broadening this out across the organization. We have had the benefit as a community of information across the spectrum. And I really want to applaud the efforts of especially our Health and Human Services team, but also HR administration, top to bottom. We've had forums for employees to get the best available science, to have forums for people to ask their questions and work through concerns and issues, and to make sure that they can pursue the vaccination opportunities through their own healthcare providers. Gone are the days where we were all just relying upon mass vaccination centers. So it's become so much more palatable and easier. I have been reading different pieces of information, but particularly studies provided through the Kaiser Family Foundation. We've done so much over this last set of 18 months. And we're at a juncture where we continue to try to save lives and preserve our economic recovery. We're at the doorstep of sending our children in Washington County back into the classroom. That is for their best development. And we all of us as responsible adults need to be focused on that and protecting kids. Remember, so many children, all of them younger than age 12, cannot get vaccinated. So it's incumbent upon us as adults. The numbers are startling, just absolutely startling to see the level of hospitalization, the highest that we've seen since vaccinations have been available. As one doctor put it, the unvaccinated are helping prolong the pandemic. Please, people, we need you to get vaccinated. According to the Kaiser Family Foundation study, 4 in 10 unvaccinated workers said they would get the shot if required. We have exhausted our efforts at persuasion. We've reached the maximum and effectiveness there. Our team across the state, across this nation, has done everything they can think of, creative and otherwise, to urge people to make science-based information available. But it's getting to the point where our economic recovery is at risk and lives continue to be at risk. Which is why I am totally open to applying vaccination requirements across this agency, Washington County, a government that is dedicated and exists to serve the community. I do not want myself or any employee of this county to jeopardize the health of another person here in our community. Just as Commissioner Rogers was just talking about, they don't have a right to impact me, my kids, or my grandkids, as he just said. So in addition to supporting the policy of today, I am totally open to supporting the application of vaccinations across the organization, and to do so in a timely manner so that employees have the opportunity to get vaccinated as quickly as possible and to go from there. You know, who knows, folks? Boosters are coming up this month, and vaccinations need to be deployed across this world. So don't take access to the vaccination for granted. Get your shot today. Protect others. Protect yourself. I don't want you to die. I really don't. So those are my thoughts. Go ahead, Commissioner Willie.
Hi, yeah, thank you. So yes, I'm supportive, of course, of the governor's mandate, and we need to adopt that. On the second part, I'm not there yet, and I can tell you that I've heard some really extreme opinions from both sides of this issue. Some of my friends that I thought would never say, no, we need to have a government mandate, are going, no, the unvaccinated are impacting everything significantly. It's time we mandate that, which surprised me. And then others who say, kind of consistent with Commissioner Rogers, it's a right and it's a freedom. It's still mind-boggling to me that, I don't know, as much as 98% of the positive cases that come from unvaccinated people, and yet you don't get vaccinated. That's outside of my understanding of just common sense. And certainly, as you both have indicated, I have a 7-year-old grandchild that's not vaccinated, of course, and is going back to school. And yeah, I have some concerns about that. But I don't think I'm quite there yet. So Tom, if you could explain just a little bit, if we would put step 2 into action, what would be the timeline? How would you see that rolling out to become a part of the policy, and either they are vaccinated or they are unemployed?
Well, it would take, we take direction from the commission. We can have something before you this afternoon. My recommendation was you'd have the, well, I'm not right, but you'd have the flexibility to have a different deadline for other workers than you have for healthcare workers, because the governor hasn't mandated that. So if you were doing your own mandate, you would be able to decide what your own deadline was.
To clarify, we have our business meeting at 10 o'clock this morning, and the healthcare item is on the agenda for adoption today. But when Mr. Carr talks about having direction from us this morning for doing the subsequent work on general application, that would not be for adoption today, because we have a work session this afternoon.
Yeah, we could have something ready for you if you chose to do that, but it would probably be better, Chair Harrington, to do it next week if that's your preference.
That would be my preference as well.
Yeah, so you have time to see the details.
Yeah,
right. And quite frankly, still look at some other things. For clarification again, one of the slides said 313 out of 2,232 employees fall under the governor's healthcare numbers. Did I understand that correctly?
Yes, that's correct. Those are the ones that have been identified currently as falling under the guidelines from the mandate.
And do we know how many of them are already vaccinated?
We don't. We have not been tracking employees' vaccination to this point.
Okay. Well, yeah, I know that this vaccination or not is health protected information, I'm presuming. So it's very difficult to put a survey out there and say, are you or are you not? But at the same time, for me, it would be good to know some of that information. So yes, I guess I'd like to, and this will be a commission decision, but I'd like to see us roll the timeline for this mandate to be longer, and that we would then also begin to put together some sort of an informational campaign as to knowing why they won't get vaccinated. And if it's a freedom right, then there's not much we're going to do about that except continue to communicate the risk that they take for not getting vaccinated, but also just a little bit of a longer runway on this. I'm not a fan of mandates coming from this commission, and so this is going to take a while for me to really be able to agree to this process. So that's just my thoughts and my requests.
Commissioner Willie, I can share with you that we do have aggregate data from our insurance carriers as far as vaccination rate. So we have approximately 72% of employees with Providence Insurance that are vaccinated and have shown their insurance card. We also have information from Kaiser that it's closer to 60% of our employees that have Kaiser insurance. So it's difficult to determine exactly the percentage, but if you look at it broadly, it would be in mid 60%. And that information is from last month. So employees who have started their vaccination series right now are not included in that number.
I got vaccinated through Virginia Garcia, and I'm under Kaiser. So would I be included in that count, or if you got it from an outside source, would you not be included in that source?
Yeah, the insurance, almost all people who are providing the vaccine are asking for insurance information because they're required to bill insurance if you have it, and they don't bill it if you don't have it. So those people who have shown their insurance cards in any location would be included in that number. But certainly there could be people who chose not to, and those are the people we wouldn't be aware of.
Okay, thank you.
Also, regardless of where you get vaccinated, it all goes into a centralized state system. And so they're able to pull by different insurance through that centralized system. I also, Commissioner Willie, you mentioned getting vaccinated or being unemployed. And I just wanted to remind the board that there are both medical and religious exemptions. So there are very, very few true medical contraindications to the vaccine, but if somebody does have that, they would be able to do a medical exemption.
Other commissioners? Go ahead, Commissioner Treese.
Thank you for this discussion. It's so important, and this really is a tough one. I will be supporting the first position. As far as the second position goes, you know, I'm struck, and I just want to bring this up. I'm struck with the juxtaposition that we require school-age children to be vaccinated to attend school. And yet we're not, we have the potential to not require the protection of those same students against a COVID that they cannot be vaccinated for. So I just want you to think about that. It struck me this morning that's a hard one for me to swallow. I concur with Commissioner Willie. I would like to see what the expanded version looks like. I lean toward that because I believe strongly that it's our responsibility to protect those who cannot protect themselves. And that's really, while I respect Commissioner Rogers' position on personal freedoms, I also think it's our responsibility to protect those who are most vulnerable at this point in time. So that's where I'm sitting, and I appreciate the work that I know our staff put in over this weekend. And I know that you were working, I saw the memo last night from Mr. Carr. I know you worked hard all through the weekend to provide us with this information. And I'm fully aware that the definitions came out late on Friday from the state about the healthcare workers. I was surprised to read the FAQs. And I just want you to know how much I appreciate your attention to this and providing us with the best information possible to make a good decision here. So that's where I'm going to be.
Commissioner Rogers, something more?
Just two quick things. One of them, Tom, you may tell me is an executive session issue. So if you do, that's fine. And I would encourage this board to do it. One, I don't disagree that if it's a governor's mandate, we need to implement it. My issue, and this is for Eva, I mean, you've got 600, 700 to 800 employees. We couldn't sustain that kind of loss if they all walked out tomorrow. So we need to figure out how to communicate. I want them all to be vaccinated. I agree to all of that. But my concern is I don't know what other accommodations, I keep saying that word, which brings me to the Tom Carr question. This commission can do anything they want, but you got bargaining units out there that I'm not really fully aware of what's going to be contested and what's not. And it would be interesting for us, eyes wide open, to understand potential litigation, potential unfair labor practices, and other issues. I don't think the governor can't take away bargaining rights. That's not something she has the power to do. So I'm just want to eyes wide open, and I would love it if we could say to these folks who do what I don't want them to do. I want them to be vaccinated. Yeah, we have some other opportunities for you that maybe we can isolate them in some way until they are educated to the fact that they need to get vaccination. So that's where where I'm teetering on. So that's been the issue. Tom, have we got an issue talking about bargaining?
Well, I can say, and Ms. Labonte has more details than I do, but we've heard from 2 bargaining units already raising questions about this. So I think it's fair to anticipate that we will have a demand to bargain or even an unfair labor practice charge filed against us if we do it. Whether we'll win or not is an open question. On the legal questions, Commissioner Rogers, I think there's probably a pretty good chance we'll get sued. I can't say whether we'll win or lose. I did review the lawsuit that was filed by the Fraternal Order of Police against the governor for the statewide mandate for all executive branch employees. It's a declaratory judgment action, so there's no damages involved, no attorney's fees. So there's some risk there. As my belief is that this is a commissioner's decision and that the law doesn't dictate an answer. If the law dictated an answer, I would tell you. I don't believe that it does. I think that it's up to your discretion as elected officials to decide what to do, particularly in your role as the Washington County Health Board.
Thank you. And I would just want to say something to Commissioner Teresa. She's a little bit younger, so I don't know that she'll remember all this, but there was no question that we had to have, even in our day, all kinds of shots, and we had little sugar pills that was in the shot for polio, and we didn't even hesitate. That's what troubles me. I mean, this is such a nothing. Anybody who hasn't had their shot, it's not harmful. It doesn't hurt you. Maybe a little sore arm, depending upon your ability to take them. And that's why I'm looking forward to getting my booster. I think it's going to be great. And I don't think we ought to be taking risks, but I agree. I just, a little nostalgia. I was there too.
Commissioner Rogers, I can share that we have received a demand to bargain the impacts of the state mandate from the Oregon Nurses Association, and also a preemptory demand to bargain from our Sheriff's Office Union, WCPOA, in the event that we mandated vaccines for them as well. We do have 3 other unions or Teamsters in land use and transportation, and AFSCME and FAPO that are involved with parole and probation and community corrections. We have not heard from them. We have gotten a request for hazard pay as that's been floated around as well, right, in the community. So we have not dealt with that directly, but that's certainly a consideration as well.
Well, I'll say, as an organization, we have made all kinds of accommodations with the presence of this virus over the last 18 months. We've had general availability of the vaccination for over 4 months with tremendous science-informed information during that time. As Commissioner Rogers mentioned last week, when we were moving forward with mask enforcement clarity, the level of hospitalization of unvaccinated folks, which is over 90% of the folks in hospitals right now, is impacting our insurance rates. There's a cost to all of this. There's also an impact for medical care and access to everyone, including people who've been vaccinated. There's also an impact to our vaccinated workforce. When someone is out sick, or on medical leave because they have COVID, they're impacting the rest of their work unit. And this is a cost to our general public. We have taken CARES Act dollars and ARPA funds to make sure that we have a healthy workforce to do the job that is needed to serve our community, but we can't sustain these costs, nor can we continue to take ARPA dollars away from helping our economy recover from this global pandemic. The more we continue to drain those funds to meet the basic needs of unvaccinated people who are sick, the less money we have going to helping our small businesses and employers recover from this virus. So that's why I support direction to our staff today to develop the information further for our future consideration. The time is now, and I don't want us to continue to live in fear of bargaining units or public opinion. I want to continue to make science-informed decisions that are in the best interest of our community. And I'm sorry, Commissioner Willie, and then Commissioner Fye. I'd like to hear from you too.
Yeah, I'm just going to follow up on Roy's comment about when we were growing up, we had those vaccinations. Mine were polio was the sugar cube. There wasn't any question about whether or not you were going to do that. I mean, you stood in line, you got your sugar cube, and you were good. But also, I Googled. I can't remember if it was vaccination success or the history of vaccinations or something. And unequivocally, they list at least 5 diseases or 5 viruses that we dealt with growing up, and every one of them were essentially eliminated by vaccinations. And it just says, I mean, this is not something brand new. We all grew up with vaccination, so having a little hard time understanding the resistance to this vaccination. But hopefully we can get beyond that.
Commissioner Fye, is there anything you'd like to share with your colleagues in advance of our 10 o'clock meeting on this subject?
Yeah, thank you, Chair. I support vaccinations and vaccines, and I really do lean for the list of options that were listed. Number 2, I would have liked this conversation to be of all employees. But now that we're considering healthcare, I have a lot of questions that actually Commissioner Willie asked. And I think maybe we need to pause for a second and really have like a methodical process to this and answer some of those questions. Like I was wondering the exact same question of the number of people who are going to be impacted of this healthcare worker definition in healthcare settings. How many of those are vaccinated? Do we actually, so and have we ever done a survey to all of our employees asking how many of them are vaccinated of the 2,200 employees that work for Washington County? And then in this conversation, if I was just a listener, there were law enforcement and sheriff's department that were uplifted. I would get the message that they're the problematic. I don't think that's the message we're trying to send. So I think if we do conduct a survey, we would know the employees who are resistant and what their reasons are. And I agree with everyone, me being the newcomer, comer meaning somebody who wasn't born in America, I learned a lot about vaccinations and where people stand. And actually in 2018 or 2019, I had a lobbying contract and I was in Salem almost every day. And that's when we had that big vaccination bill. And I've heard moms who were crying their hearts out, convinced, these vaccines for their kids were really bad. And then we had people who were convinced this. So I think we will always have that argument, people, throwing their card around, the freedom card. But I think we can get past that with exemptions. The religion and the medical exemption exist. And if there is more that we need to consider for our employees, I think we can have that conversation. But I think for me to support this today, I need all those questions answered to really understand, like, what's the impact of, is it one person that isn't vaccinated of the 300 that was listed? And is this really a symbolic then? I support the governor's mandation, but I think we maybe should pause for a second today and really answer those questions and come back maybe next week to say.
So I'm a little confused. I'll just pause. There's what we need to do in order to meet the requirements for the state healthcare by a particular deadline. Then there is the potential for us to come back and give consideration to wider application to our employee base. We're under a time pressure on the first, and we've all had the benefit of a briefing with regard to those, or I thought we each had the opportunity of a briefing for those requirements. So are you casting doubt with regard to the first or just the second?
I'm saying the first one, I'm not sure if, I don't know if we actually, I'm wondering if we even met the deadline. Do we actually know how many that are not vaccinated?
I don't understand how that affects the policy. The number,
Well,
the application of the number.
So the policy, the way I see it, is we're requiring our healthcare professionals in healthcare settings to get vaccinated. Correct? You can nod your head. I know you're muted. Tom, you can
The
correct.
state is requiring us to apply that definition. And so our legal team and our HR team have come back to us with the implementation of that we need to approve.
But I'm saying, what if we met that requirement? What if all of our healthcare employees are vaccinated? Do we even need that policy?
That's a different question.
Well, from what we've heard from our employees, I'm pretty confident in saying not all of our employees that are listed in juvenile services and health and human services are fully vaccinated currently.
And if I may, one of the things that this policy will do is give us a read on that, because every affected employee will have to either show proof of vaccination or file an exemption or lose their job. So there are three options. So after we implement the policy, we'll be able to tell you with certainty what percentage of those employees are vaccinated. And Ms. Labonte provided numbers earlier that suggest that overall, based on our insurance data, we know that about roughly between 60 and 70% of all employees have used their county issued insurance to get their vaccine. So somewhere between 30 and 40% of county employees are unvaccinated. We don't know where they are, but you could assume that there is some distribution among the 313 who would be subject to this mandate.
But is there a way to survey those 300 to ask those questions to know for sure?
Well, the policy will effectively do that.
Well, before the policy, I'm trying to figure out if this policy is even necessary.
Well, the challenge is because of the timeline. If you do not adopt the policy today, it'll be very difficult for employees to get vaccinated by October 18th. So it'll put the county out of compliance with the state mandate.
Can I jump in? Because Commissioner Fye, I don't want to interrupt your cadence, but that's exactly the question I had of sorts. I was told in my small organization, we could go ahead and survey folks and we could ask them to show proof. And Eva would have to tell me if in larger organizations that's not the case, but we do. I know exactly who's vaccinated and who's not. And my rub again is for the additional provisions of seeing if we couldn't place them somewhere else so that we're not just firing people. But Tom, I asked you this question. I think it might be appropriate for the rest of the group. I kept saying, if the guy, I'm a rule follower. If the governor says we got to do something, I'm there to follow the rule. But why do we have to do it? If she mandates it, we just say we follow state law. So why is it incumbent upon us to do that?
The mandate includes a requirement that all employers adopt a policy into implementing the mandate. And so that's what we're asking you to do today. So we can't just rely on state law. We have to have a policy. And also for our internal purposes, if we're going to discipline employees based on failure to comply with a policy, we have to have an employment policy adopted by the board, implemented by a procedure in the administrative office.
I've always seen that we've simply said we follow state law and everything. I've never seen us not follow state law. And mine is just simply to give the time to get these folks into other positions. So we don't fire 600-700 employees potentially just because they're not vaccinated. If we can use them at home, we can use them elsewhere. I would like to save those jobs. So maybe that's where I guess we'll see those suits coming and we'll deal with it. But okay, all I need to say has been said.
The challenge with
Commissioner Rogers, I follow your train of thought in you don't just fire hundreds of employees. I certainly don't do that without making reasonable accommodation, right? And we do have reasonable accommodation. We've had reasonable accommodations by virtue of our work environment and conditions. We've invested a large amount of public funds to have folks telecommuting, working from home, isolating, given folks months and months with great access to the best public health information available. And it's just a matter of how much longer can we afford to spend the public's money on that reasonable accommodation? That's the question for me. I think it's a false argument to say it's about personal choice. If it's truly about personal choice, then it's a matter of saying, where do you decide to work? And for me, it's, can we as a public employer in service to the community continue to endanger people's lives by having unvaccinated people serve in these public-facing, public-serving jobs? That's where it can get all tied up in knots, but I fall back on that reasonable accommodation. But I also look forward to the particulars from our staff that we'll be learning more about in the coming days and weeks.
And I just wanted to add, under the EEOC has said, we can ask employees if they're vaccinated. We cannot require them to answer. And we can also not require a further conversation, whether they say yes or no. We can't continue the conversation as to why they're not, but they can also refuse to answer because it's protected health information.
I have a question. Is the option of getting tested being subject to weekly or twice a week kind of thing? Why isn't that being considered rather than medical layoff?
The administering that we've heard from the governor's office, but also just from providers, that the logistics of testing facilities being overwhelmed with those kind of weekly testing responsibilities is that what they've said is it's just not feasible to have that many people tested on a weekly basis and have the results come in. And what do you do while you're being tested and you haven't gotten results? And so that's why the governor a week later took that off of her mandate, just because of the logistics. So it was just too impossible to administer that.
I wanted to add, it was removed from the governor's mandate.
Mm-hmm.
And we're prioritizing schools and school personnel in our testing because there is limited capacity to do frequent testing. So there's a lot of different options that we're focused on schools and federally qualified health centers.
Yeah, but not to be argumentative here, but I think the governor's mandate is to maximize the impact because there's more. And since ours is only 300, I think it makes reasonable to say rather than medical layoff, we could do, you'll be subject to, every 2 weeks at testing.
Commissioner Fry, I also just wanted to, as a healthcare worker, this is not the first vaccine that's been mandated for healthcare workers. Healthcare workers are required to get several vaccines before we enter, actually as students, before we ever enter the workforce. So I don't think it's unusual to require healthcare workers in particular to meet vaccine mandates because we need to protect the patients that we're caring for. So measles is an example, hepatitis B is an example, and it's both to protect polio. There's, 10 or 12 vaccines that are required for school kids and for healthcare workers to protect the general population. So just for a little context, it's not unusual in the healthcare worker field.
So what I heard is there are at least 3 of us at this stage that have the information that we need in order to be able to move forward with the proposal that's on the table for our business meeting at 10 o'clock for the healthcare worker implementation. Then what we've heard across the Board of Commissioners is some interest in potential application across the employee base, but we're seeking additional information about what that implementation, what that policy would look like, as well as to gain further information about the employee base as well. Is Ms. Angie, Mr. Carr, Ms. Labonte, and Ms. Kyle, does that seem like the summary or an appropriate summary from what we've all heard today?
It is, Chair Harrington. I would just add, relative to the request for a survey, we'll be discussing that internally so that it does meet conditions of health information privacy, and also being thoughtful of potential public records requests. But we'll look further into this and explore what those options are.
All righty. Well, that's what we had on the agenda for this morning's work session in advance of our 10 o'clock meeting. Was there anything else that either leadership wanted to close on this topic or Board of Commissioners before we close out this section before our 10 o'clock meeting? No? Okay. Then I suggest that we take intermission from our work session. And at 10 o'clock, we will convene as the Washington County Housing Authority. Then we'll follow on with the Washington County Board of Commissioners meeting. Commissioner Willie?
Yeah, my comment's not related to the vaccination issue. It's related to an item on the board agenda coming up this morning.
Yeah, great.
And this is just informational so that you can have at least a few minutes to think about it. I'm going to ask that we pull the MSTIP decision and postpone that for a couple of weeks, and I'll explain why in the board meeting. But I just wanted to let everybody know that's what my request is going to be, so that you can kind of cogitate on that over the next 18 minutes.
Well, so we're hearing that you want to pull it, but you should expect that not only will we want to hear why, but we'll want to hear discussion, because I think Mr. Carr can correct me, but I think if a majority of commissioners want to continue to press on with the work plan, that we would be able to do that.
That's
yes,
correct.
I'm fully aware of that. And again, I'm more than willing to have that dialogue when that item comes up. I just didn't want to surprise everybody by doing that. So
okay,
some advance notice.
Okay, great. Thank you. Appreciate it. Were there any other questions on items that are on either the Housing Authority of Washington County or the Washington County Board of Commissioners meeting today? Okay, All righty then. So we'll take a break and I'll see you again on a different Zoom link for 10 a.m.
Thank you, Commissioners. See you in 15 minutes.